Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 158 new cases of COVID-19, which brings our total to 199,589. Our new 7-day rolling average is down 18 to 168. Unfortunately, we do have 3 new deaths to report this evening. The total lives lost in our community to COVID-19 since this pandemic began is 2,864. Please do keep in mind that those are lives that were well lived and now are lost, family, neighbors, friends, and colleagues who are lost to this virus, so please keep them in your prayers this evening. We have 3 fewer COVID-19 patients in the hospitals this evening, down to 237. And that, again, is the first time, for the first time since early November, we now have fewer than 100 patients in the ICU. We now have 97 patients in the ICU this evening. There are 35 new admissions over the last 24 hours, and 63 patients this evening are on ventilators with COVID-19. Let me give you an update on the vaccine numbers overall. We mentioned yesterday that 319,011 people in Bexar County have received their first dose, and 184,348 people are fully vaccinated in our community. Of those, more than one-third are over the age of 65. Seniors make up the largest age group of those who have been vaccinating, and that is, of course, by design. We want to make sure that those who are most vulnerable to the severe impacts of this virus are being vaccinated first, so that's going very well. Of the total population of residents 16 and up, 18.3% have now received at least one dose in Bexar County. And again, as we work to get more people vaccinated in our community, please continue to wear your mask and practice social distancing. Let's work together to protect one another from this pandemic. Let me turn it now to Judge Wolf.
Well, we really are in a race to get vaccines in quick as we can and to get them administered as we try to counteract this COVID, and then with the relaxed rules, we're having to move as fast as we can. At University Hospital, we'll end up doing about 21,226 by the end of this week, which includes Saturday also. Tomorrow, we're going to focus on 1,500 teachers and over 1,100 healthcare workers that have not been vaccinated. So that's what we'll be doing Saturday. The following week, we'll continue to do work through the bookings we've already got. And then on March the 29th, we'll open it up for more appointments, and that would, of course, include those 50 years old also. So if we get the vaccines in, obviously we can do more and more every day, and so it's a matter of continuing, we've said over and over, supply, but we're doing everything we can with what we've got now. You know, it's kind of interesting when you look back and trying to figure out where we're headed and what will happen. I was looking back on April 29th. We only had 55 people in the hospital, and then the governor took away our mandate on face mask, and we exploded through the summer. And it was only about 3 months later we went from 55 people in the hospital to 1,261. Then we worked our way back down again in a successful manner. And by August the 12th, we got down to 184. But then the winter storm hit us, and the changing hit us, and that second wave hit us, getting up to 1,520 by January the 18th. So you can see they're sort of parallel. Now we're down to 237, but we still haven't hit that low mark that was in between what we did this summer and what happened this winter. So we've got a lot of work to do to continue to do it. Again, want to call out to employers who have stepped up in providing a safe environment, including the Bang Bang Bar and the Virgin Plant Company and the Lifetime Family Eye Service, Northside Auto Group dealerships, Office Furniture Liquidators, Pinstripes, Classic Barbecue, Classic Barbershop. So everybody's stepping up, so we want to thank very much the businesses that are being very careful how they protect their customers as well as their employees.
Right. Thank you, Judge. And if there is a moral to that story, it is please continue to do your part. Do mask up, please, as you wait for your vaccine. And if you do want to get alerted to the vaccine appointments as they become available, please text vacuna or vaccine to 55000, and you'll get a text alert when new appointments become available in one of the public health labs that are providing vaccines. Also, it's Friday, and I do want to point out some of our contact tracers of the week. Again, our contact tracers have been working double time throughout this pandemic to identify and trace the infections that occur in our community to help contain them and make sure they don't spread unnecessarily. So thank you to Johanna Hunter, who's been working remotely, and Brenda Maldonado, who's been working out of the Alamo Dome on contact tracing. They've been doing an outstanding job this week. Thank you both. And while we're talking about contact tracers, they did hit an important milestone this week. 50,000 cases have been investigated by the UT Health School of Public Health team since August, and 11,000 contacts have been traced since November. Incredible work by Dr. Jack Sy and his team of contact tracers that are helping fight this pandemic through their investigative work. And again, if you are having trouble paying the rent or mortgage through this pandemic, you can access our emergency housing assistance program by calling 311. Or if you are out of work without a job in this pandemic and would like to train for jobs that are available today in our community in high-demand careers while you get a stipend to make ends meet, you can enroll at 210-224-HELP. That's our Train for Jobs program, training for jobs that are available today. And as always, you can get the latest on COVID-19 by texting COSAGov to 55000 or by going to the website covid19.sanantonio.gov. Please continue to do your part, protecting one another. Mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. The judge and myself are available for questions.
President Biden established yesterday that all adults must have access to the COVID-19 vaccine no later than May 1st. What form of registry, platform, or system will City of San Antonio have to guarantee access to vaccines for all?
Again, what we are hearing and what we are anticipating is that as these vaccines continue to roll out, they're going to continue to go in a more decentralized manner to pharmacies and clinics all across the community, including places like CVS and HEB and Walgreens. So I anticipate there's going to be even more places to get vaccines. You're going to continue to see our work through a text alert system for those vaccines that are available through the public health labs.
You know, the state has a register of providers, and then the federal government's also setting up some. So the providers are going to continue to expand and offer vaccines. With our mega site at the Bexar County Hospital that we're doing at Wonderland in downtown, we will continue to ask people to register and under the same system we've been doing, but we'll be starting that March 29th, where anybody can register according to the new group 50 and older, and we hope to start that then and be able to have hopefully more vaccines by then and be able to do more. But we'll do that, and we'll probably book ahead 2 or 3 weeks like we've been doing. The more vaccines we get, the more that we'll be able to do it.
Is there hope now that holidays such as spring break will have a much more blunted impact with the amount of people that have been vaccinated?
Yes.
I think that's true. I think, you know, the tool we've got now that we didn't have after the summer surge and then going into the winter, the tool we've got now is the vaccines. We didn't have that tool before. So it's a very powerful one, and the more that we can get people vaccinated, the better off we're going to be. It's been a very powerful tool for us.
And we're going to continue, of course, to remind people to wear their masks throughout, whether or not they are vaccinated.
That's all we have tonight. Thank you.
Great. Thank you.